I'm Asa Bradman at the Center for Environmental Research and Children's Health, and we do a lot of work to understand environmental exposures to children and also pregnant women, and understand what the impacts are on children's health and development. One of the reasons we're especially concerned about children is because they're more vulnerable to toxic substances. Young children, of course, eat, breathe, and drink more for their body weight. They also have a bigger surface area of skin relative to their body weight. So if there's any chemicals in the environment, they get more of it in their body for each pound of weight, say, compared to an adult. So even though you look at your baby and you think they're not eating enough, in fact, they're actually eating a lot more than you are for how much they weigh. So if there's any contaminant in that food or in the air they're breathing or anywhere else in their environment, they're actually getting more in their body. It's also at a time, of course, with young children, and especially even before they're born, there's a tremendous amount of development and change going on. So cells are dividing, they're becoming new tissues, and they're forming the framework that's going to be that child and that child for the rest of their life. So it's possible that some chemicals, in particular, say neurotoxic chemicals, can disrupt that development and put them on a trajectory that's not as healthy as it could have been. We've been studying pesticide exposures in families living in agricultural areas in Monterey County for many years. And one thing we found is that higher exposures during pregnancy in the women, especially exposure to organophosphate pesticides, which are neurotoxic, seems to be consistently related to poor neurodevelopment in the children as they get older. We've seen that up to age 7 and even up to older ages like age 12 and 14. So this argues, provides more support for the idea that an especially important time to reduce exposures is during pregnancy. Shorter gestational age at birth, lower birth weight. We've also seen poor neurodevelopment at toddler ages like 12 and 24 months old. Also lower IQ at 7 years, and also behavioral problems like more ADHD type symptoms in kids where there were higher exposures at pregnancy. We've also seen lower IQ scores at older ages too, up to age 12 and 14, and that's something we're looking at more carefully, which kind of makes sense. I mean, these pesticides are neurotoxic. The exposure levels really should be low enough so that their use is safe. But given what we're finding, we have concerns now about these low-level, especially early exposures during pregnancy and poor neurodevelopment in the children. They're still used on citrus. They can be used on strawberries. They can be used on grapes. So really, they can still be used in a lot of fruit and vegetable crops. And actually this can create, I think, a tension for people where they're concerned about exposures through food, but these are also some of the more nutritious and healthy foods that we should be eating. So the advice that I give to people is, one, they should wash their food carefully. I don't think people should be afraid of their food. I think it's important that we develop policies and support farmers to use pesticides and other tools that minimize the more toxic chemicals. And in some cases, people may want to choose organic as an alternative. We've also conducted studies ourselves, and there's other research out there showing that if you choose organic food, you can reduce the pesticides that you're exposed to.